This lecture is about empowering the woman. This presentation is based on extensive literature review and 3 published articles published by myself. Basic hormonal issue is that estrogen declines in women. Bleeding and burning sensation are happening during intercourse. And of course, there is low self-confidence leading to interpersonal conflict or neglect. Vaginal atrophy pathophysiology, they have several changes occur in many levels of the vagina. This is a normal vagina, healthy, and this is an older, more elderly, dry lining of the vagina. Now, in the pursuit of happiness, women attempt to resolve the psychodynamic roller coaster of aging by merely altering their vaginal physique. Laser and RF vaginal rejuvenation procedures claim female satisfaction. There's a lot of papers that have published on this subject. However, radiofrequency research reports success without achieving statistical significance. So, and also some of the RF research does not use valid standardized tests to assess sexual satisfaction. An example is Anisot et al. Study in 2017. They report that 23 out of 25 subjects reported sexual satisfaction, but that is 0.08%, which is not significant. Now, only 9 out of the 25 subjects reported increased satisfaction regarding their orgasms. So that's only 36%, that's below chance. And 16 out of 25 subjects reported no change. That's just slightly above chance, 64%. Other laser reports report success as well, but they lack statistical significance. For example, this study here reports they use the FSFI, which is a valid instrument. However, they report that there was reduced distress and decreased vaginal laxity at the probability of 0.001, but only 92.9%, and that's the probability is 0.8 of the subjects reported significant satisfaction or increased satisfaction. Another study reports again that sexual life was significantly improved, again 0.001, but only 85% of the substance 0.15 gained normal sexual life. And very important, 26% of the women who were not sexually active, how could they evaluate overall sexual satisfaction? Other scientific research reports that the focus just on vaginal physique ignores age-related hormonal changes, depression, anxiety, quality of life, effects of about 200 known hormones, psychological dynamic states, the complexity of sexual desires that involves health status, CNS, neurotransmitters, cognition, attitudes, and so on and so forth. And this is one of the articles that is giving us this information. There are side effects with lasers RF vaginal rejuvenation. There's a number of federal agencies, including the FDA, that have recently issued warnings against such cosmetic procedures, especially the FDA that had a study on 46 patients. There were reports of pain. The majority of patients sought medical care for their injuries, which include evaluation by urgent care, urology, gynecology, nephrology, neurology, gastroenterology, pelvic floor therapy, primary care providers, and device operated. 33 patients indicated chronicity of their injury, which included long-term pain, numbness, burning, bladder disturbances, infections, dyspareunia, worsening symptoms, and disfigurement. These are very severe side effects. The most important, however, is that lasers and RF studies do not have validity issues. They have methodological and validity issues. Threats to internal validity is one of the most known threats, is the instrumentation. Now, the FSFI is validated. However, it's a self-report questionnaire. And it's short, straightforward, it's transparent, you know exactly what it's after, and it's prone to denial, poor self-awareness, or lying. Some women may be primarily concerned with satisfying their partners rather than themselves. Women may conceal the truth due to a fear of disapproval or because they blame themselves for their physical problems persisting despite the expensive intervention. We administered the MMPI to 14 menopausal women who had undergone vaginal rejuvenation and had very high FSI scores. Now, what basically the MMPI was looking at was comparing the FSI scores with the MMPI life scale, the depression scale, and the hysteria scale. And what we found is that there was a statistically significant result in different statistical tests that we run between the FSFI and the life scale at 0.01. So most of these women were either in denial or they were just purely lying, basically, that they had gained satisfaction. The hysteria scale appeared very high, and basically it gave an outside appearance for a need for acceptance that an individual is always vibrant and pleasant. And on the inside, the depression scale correlated very high with the FSFI, so there was depressive affect on the inside. This was also confirmed by another instrument, the differential emotional scale, that revealed that 98% of these women that had received vaginal rejuvenation, they were claiming great success for the results, were organized around shame, sadness, and joy. Basically, the joy was the forefront, and underneath, on the inside, there was shame and sadness. So there are several questions. Will changing a woman's physique really, will it guarantee her happiness? Will vaginal rejuvenation improve her quality of living by itself? Probably not, because it's not just the vaginal rejuvenation, it's the hormonal balance that is very important. And it's not about replenishing one hormone, it's about a harmonious interaction of hormones working together. Cortisol rising towards the peak of the normal range increases stress eating. 3 to 3 can lead to hypothyroidism and weight gain. And of course, it's very important, a preventing perspective has to focus on the rate of differentiation within the normal range to see what would happen, or if one of them basically is going to be elevated or decreased below very, very soon. Now, a drop of estrogen can contribute in belly fat and obesity. And metabolism slows down, so you have a decreased basal metabolic rate. So we did a study with a new technology from London University, and we showed that actually BMR increased and weight loss increased and kilograms decreased. And it was quite pronounced, actually. It was BMR was 97.44% increase, and weight loss was 6.62 kilograms. Now, the reason why it wasn't very much, however, these individuals also built quite a lot of muscle. We showed that there was fatty liver on 7 patients. We have a new study with 11 patients, and we again found fatty liver before the treatments and no fatty liver after the treatments. So basically, it seemed that this technology decreased overall fat and visceral fat, increased muscle mass at a very significant level, and fasting blood glucose and postprandial blood glucose, insulin, fasting and postprandial, insulin, both fasting and postprandial. Upper abdomen reduction in cm was about almost 960.65 inches, 10.22 cm, and the lower abdomen was 11.5, and weight loss 658, triglycerides increase 72%. And there was also an increase in HDL. So how